So once again, thank you to USV for having me for this very interesting session. So today I'm going to talk to you about fitness prescription in elderly type 2 diabetes patients. Now my presentation will be on in two parts. Uh, in the first part, we are going to discuss fitness prescription in patients, adult patients with diabetes in general, and the second part is, what we are going to discuss is about in elderly, specifically in elderly, right? So this is the flow which we are going to do in the next few minutes. Now, you'll hear this term very frequently, both from me and from Dr. Divya. We are going to talk to you about what is known as a MET. Right now, MET is what is known as metabolic equivalent of a task, and it is basically calculated as a metabolic activity during a given task divided by metabolic activity at rest. So, how much of a metabolic equivalent you are doing during an exercise, that is what is basically calculated as a MET. Typically, as a convention, 1 MET is equal to 3.5 ml per kg per minute of oxygen consumption by a 70 kg man. So that is what is a single 1 MET. Now, when we measure fitness, the maximum MET which a person can achieve is a measure of what is known as fitness, right? So you're talking about fitness prescription. So what is fitness? Is that's the maximum MET which a person can achieve. That is what is known as fitness. Now, to give you an example, what is typically a MET of a brisk walk? A brisk walk is typically a 3.6 MET exercise, right? So that's what to give you a ballpark figure of what we mean when we say a MET. Then we have a concept called MET hours. So MET hours is basically MET of an activity into the time duration of that activity which is done, which is known as MET hours. So for example, if you are doing a brisk walk for 1 hour, it is 3.6 MET hours, right? So that is what you will say by MET hours. So now let's talk about a little bit about metabolism that changes in patients with diabetes who exercise, right? So exercise is very important in patients with diabetes. We all know that. We all prescribe exercise to our diabetic patients, but we'll see what are the benefits of the same. So one very important concept that we all need to understand, and that is the fundamental concept that you have to understand in patients with diabetes, is that exercise reduces insulin resistance. It reduces insulin resistance, right? This is a very, very important fundamental principle that you need to understand, right? In fact, to a lot of my young physician friends and my young students, there is one thing which I often teach them, that sometimes we are all forgotten a little bit about exercise, right? So I always say that our favorite drug that we use in diabetes, that is metformin, right, is like exercise, right? So all the benefits of metformin that you get from exercise, and all the little bit of those side effects that you get from metformin is also what you get from exercise. For example, why these two are very similar? Both act on the AMP kinase pathway, right? Both act on the AMP kinase pathway. So both exercise and metformin act on this pathway. Both of them reduce insulin resistance. So again, if you want to see what is the impact of diabetes or exercise on diabetes, it is basically reducing insulin resistance. Also, if you see in terms of the it can produce a little bit of weight loss, though more or less it is weight neutral. Remember, exercise is also weight neutral, but it can produce when you do a little bit of more vigorous exercise, sometimes it can lead to weight loss. Same with metformin. So these are all benefits. It has, of course, cardiovascular benefit to some extent. Again, just like metformin, there is no solid proof of cardiovascular benefit, but we all know that such benefit really exists. So you have CV benefit with exercise and with metformin. Again, in terms of side effects, if you do too much of vigorous exercise, you can develop lactic acidosis. Same thing you can develop with metformin if it is given in very high doses in inappropriate patients, right? Again, if you have a patient with heart failure or some other condition where lactic acidosis risk is higher, just like metformin, exercise can also induce lactic acidosis, though it is very, very, very rare, right? Again, exercise can produce a little bit of a reduced appetite, which is again seen with metformin. So these are all very similarities. There are a lot of similarities between metformin and exercise. So what I suggest is that if you want some additional benefit similar to that of metformin, remember metformin is the first line therapy in patients with type 2 diabetes. So same way, exercise is also first line lifestyle measure that you should prescribe in your patients with diabetes. Now, one very important question we need to understand is that is only aerobic exercise enough? We'll discuss what is aerobic, anaerobic, muscle strengthening exercise, etc. in the upcoming slides. But recent studies have shown that you need to do a combination of both aerobic as well as anaerobic or resistance training or muscle strengthening exercises apart from aerobic exercise to get the full benefit of exercise. So it is not just walking and swimming and running. You need to do some amount of resistance training also to get the full benefit from exercise prescription. So what are the benefits of exercise in patients with diabetes? Just like I told you, it is very similar to metformin. So it improves glycemic control. It can produce an HbA1c reduction of 0.5 to 0.7%, very similar to metformin again, and it has been proven in several meta-analyses that it improves the glycemic control. So this is a very well known fact that that a good exercise can reduce HbA1, good exercise regime can reduce HbA1c close to 0.7% on its own term. Of course, there is a concept called high intensity, low volume exercise. These are short bursts of high intensity exercise. For example, you can do vigorous cycling for 1 minute and then take rest for 1 minute and so on. So these are all high intensity, low volume exercises. These are also very effective for, of course, a lot of elderly patients may not be able to do this, but your adult patients, people, typically patients with sedentary lifestyle, this type of exercise is very, very beneficial. This can not only improve cardiovascular outcome, but it can also improve glycemic control as well. So this forms of exercise also you should consider doing. Unfortunately, I am right now in a different city than where I live. So I live in Ahmedabad. I am in Baroda right now, but in Ahmedabad, if I had the opportunity of giving talk from there, my own entire desk setup I have set up in such a way that it's a standing desk, not a sitting desk. So most of my work that I do at home is in a standing position, and also have a little stepper in below my standing desk. So what I do is after every 20 or 30 minutes of work, I go on the stepper and do a few steps on that, and that is something which is very effective for me in my own personal way. So these are a few tips that I would like to give from my side. Now, exercise, does it reduce cardiovascular mortality? It's a controversial question, but answer to this broadly is yes. It is mainly, however, proven by prospective cohort studies. So you don't have a good RCT to prove that, but of course it is very difficult to conduct such an RCT. Having said that, from prospective cohort studies, we know that in patients with type 2 diabetes, exercise does reduce cardiovascular mortality and improves the well-being of a patient. Now, let's look at what American Diabetes Association and American Heart Association guidelines say about exercise prescription in patients with diabetes. Now, these are the guidelines. So, in fact, if you want to take one screenshot of my presentation, this is the screenshot you should be taking. These are the exercise recommendations for adults with type 2 diabetes as recommended by both ADA as well as American Heart Association. So what they recommend is that there should be more than 150 minutes of moderate intensity aerobic exercise, that is exercise between 3 to 6 mets. I told you that a brisk walk is 3.6 mets. So about 3 to 6 mets of exercise, that is moderate intensity exercise, is what you should be doing at least in a week, right? So 150 minutes in a week is the amount of exercise you should be doing, or 75 minutes, more than 75 minutes of vigorous aerobic exercise, that is more than 6 minutes, like for example jogging, right? So these type of, or running, this is the minimum amount of exercise they should be doing. Generally you should be doing it in a 30 minutes a day for 5 days a week, and it should spread over at least 3 days a week with no 2 consecutive days without exercise. So these are the broad recommendations as given by the guidelines in terms of an exercise prescription for adults with type 2 diabetes. So would you do resistance training? We already discussed this, and as we discussed that resistance training apart from aerobic exercise does have its own benefits. So diabetics are advised at least twice a week they should be doing resistance training, one set each of 5 different major large muscle groups. You should consider doing. Of course, there should be no contraindication to that. We'll discuss these issues as well, but that's the broad consensus which we have in terms of the recommended guidelines. Now, if you are somebody who is trying to lose weight, remember this very important concept which we all need to understand, that diet produces weight loss, whereas exercise is generally weight neutral, right? It's generally weight neutral. So this is a fundamental concept you need to understand. However, if you are somebody who wants to lose weight because of exercise, then you should consider exercising 60 minutes a day for 7 hours a week, right? So you should be exercising at least 7 hours a week if you want to lose weight or of course maintain a good amount of weight. So that's the important recommendation that you need to understand from exercise perspective. Right. Now, of course, your patients with, these are patients with diabetes, these are not patients who are general patients. So there is some amount of pre-evaluation that you might have to do before you, or some preparation you need to do before you give an exercise prescription. So a frequently asked question is, do you need to do a treadmill test or a stress test before exercise is being prescribed? Well, answer to that is basically no. Only those patients who have claudication or chest pain need to get a stress test done. So not all patients need a stress test, right? And a sedentary diabetics who are more than 50 years must get a baseline ECG done. At least a baseline ECG should be done, but you know, you don't need to require a treadmill test in all patients, only in patients who have prior history of chest pain or claudication. Retinopathy is something you need to be careful, especially patients with proliferative retinopathy. They need to be stabilized before exercise is being prescribed, especially for those patients who are doing resistance training. In such patients, proliferative retinopathy should be looked for, and because sometimes it can lead to trigger a bleed in such patients. So this is something. So good, you know, a good retinal examination, fundus examination should be done before you start the exercise prescription, which is of course part of the routine care. Now, of course, a special mention should be made about patients with neuropathy. So patients with peripheral neuropathy, especially when they have loss of protective sensation, they should avoid long distance running. So marathons should be generally avoided, and if they do, they should wear protective footwear. So this is something which is very important for patients with neuropathy. Can patients with chronic kidney disease also exercise? Answer is yes, right? So there is no contraindication to exercise, but of course, very severe vigorous exercise should be avoided in such patients. Having said that, routine exercise, typically 3 to 6 met exercise can easily be done in patients with chronic kidney disease and diabetes. This is one rule of thumb. Of course, this is not true for everybody, but you know, especially type 1 diabetes, you should be a little careful that before the exercise, the blood sugar should be ideally more than 100. If it's more than 250, again you need to be careful, and they should not be having ketosis before they exercise. So this is, I think, more applicable for type 1 rather than type 2. However, these principles should be followed more or less frequently. There is a something known as a FIT model of prescription. FIT stands for, F is frequency, that is frequency should be nearly daily. I is intensity, that we discussed, 3 to 6 meds of moderate intensity exercise. T is the type of exercise, aerobic plus muscle strengthening, right, should be done, and the T is for the time, that is at least 150 minutes a week, right. So that the acronym given for this is known as the FIT model of prescription for patients with diabetes. Now, of course, we are dealing with diabetic patients, so we need to understand that there will be some amount of blood glucose changes that occur during exercise. So what is it that you need to be careful? So if your patients are on sulfonylurea or insulin, they run the risk of hypoglycemia you know, during exercise. So that is something we need to be careful. So you need to take adequate fluids during exercise, and if the pre-exercise blood glucose is less than 100, then you should take 15 grams of fast acting carbohydrate 15 minutes before exercise, and repeat this carb every 30 minutes during exercise, and you should check blood glucose ideally every 30 minutes during exercise. If you are using a CGM, that's a good idea. And of course, take a long acting carbohydrate at the end of exercise, for example, a dry fruit, etc., to prevent late hypoglycemia, right. This is something which is very important. It's something you need to understand. So when you're doing aerobic exercise, right, this is something which is important, right, to understand. Aerobic exercises lead to late hypoglycemia, right. So it often produces hypoglycemia late, and so when you have a patient who is doing an aerobic exercise, the blood sugar typically falls like this, right. There is a fall which happens. When you are doing mainly anaerobic exercises, in such cases what happens is there is an initial spike of blood sugar, and then there is a gradual fall of blood sugar, right. So if you are doing an anaerobic exercise, you will find a little spike of blood sugar at the onset of anaerobic exercise. So again, you know, this is a recommendation which a lot of people have said, especially for type 1. So you start, you know, if the patient starts with a blood glucose which is on the higher side, then you should do a aerobic exercise first and then end with an anaerobic, right. And if you have somebody who you know, tends to have a little low sugar, then push with an anaerobic exercise first, so this boosts up the sugar, and then go for aerobic exercise, right. This is something which is a little bit of an idea which you should consider as a little you know, biohack for patients with diabetes. Now, patients those are not on sulfonylurea insulin, you don't need to worry about it so much. Your patients on DPP4, etc., you don't need to worry. But of course, you have to remember SGLT2 patient, there is a special mention here. Patients with SGLT2, there should be proper hydration, and also you know, if the patient has any evidence of euglycemic ketosis, exercise should be avoided for sure. Again, those patients who are injecting insulin, you need to understand that it should be administered in part not going to be involved in exercise. For example, if you're playing tennis, your arms are going to be involved, or if you're cycling, your legs are going to be involved. So in those areas you should not be injecting, because if you inject at those areas, the absorption of the insulin becomes unusually high, in which case it could trigger a hypoglycemic event, right? So these are some important precautions. So again, for more precautions, you should take insulin at least 60 to 90 minutes before exercise, and reduce the dose of insulin by 30% at the time of the patient going to exercise, especially those patients on pumps, insulin pumps. Of course, not relevant to type 2, but for in type 1 patients on pumps, you need to reduce the basal dose by about 30%. Okay, now let's specifically look at elderly patients with type 2 diabetes. What are the special precautions that you need to take in elderly patients with diabetes? Now, this is again second most important slide of the entire presentation. Your elderly patients, there are 4 types of exercise they should do in all of your elderly patients, right? Now, one is of course aerobic exercise. We'll discuss all of these in a little detail. Second is muscle strengthening exercise. Third is flexibility training, and fourth is balance training. So these are the 4 categories of exercise that you should consider in elderly population. Now, there is something called an easy tool. So before a patient who starts an exercise prescription, there are few questionnaires which you need to ask. So this is called easy questionnaire, which a patient needs to answer before he or she begins the exercise regime. So the first question is, do you have any pains or tightness in the chest? So you have a chest pain during walking. This is dealing with patients who are having angina. We need to ask them, do you have dizziness or lightheadedness before starting exercise? Have you been told that you have high blood pressure? So you are again untreated hypertension. You need to be careful. Do you have pain, stiffness, or swelling that limits or prevents you from doing what you need? Do you fall, feel unsteady, or need assistive device while walking? Remember, we are dealing with elderly patient. Is there a reason not mentioned why you should be concerned about starting an exercise program? So these 6 questions should be asked to all your elderly patients before they begin the exercise program. Right now, let me give you an algorithm of how to really based on the easy question, you need to see whether you need to do a pre-operative evaluation, pre-procedure evaluation or pre-exercise evaluation in your diabetic patient. So if the patient has any of the of the 6 questions that we asked, if any of that is yes, then the patient needs a medical clearance. So you need to do a exercise stress test before. Remember, these are elderly diabetic patients, so you need to be careful. However, if the patient, the answer to this is no, there are no such issues, then you need to see if the patient has diabetes, cardiovascular disease, chronic kidney disease. Of course, we are dealing with diabetic patients. So again, in such cases, if they have such a history, then you need to if the patient is already exercising, you don't need to worry. But if the patient is not exercising, again, it's a good idea to do a medical clearance. So again, diabetic elderly patient, it would be a good idea to consider doing a stress test in such patients. Routine patients, you need not to worry about, right? Again, if such patients there is does not want to pursue any intense exercise, then you don't need to worry about it, right? So you can check out this algorithm. This is taken from Up to Date, so it's available there. Again, if the patient is not diabetic, then of course you don't require medical clearance in routine cases before you begin exercise, unless of course you have some other risk factor involved. Right, now let's look at aerobic exercises in more detail, and what is aerobic exercise, and some examples of this. So aerobic exercise is something which involves sustained use of large muscle groups, and it stimulates and strengthens the heart and lungs, and it improves the body's ability to utilize oxygen. So some examples of aerobic exercise are brisk walking, jogging, swimming, tennis, golf, right? These are all examples of aerobic exercise which your elderly patients can consider doing. Again, AHA recommendation for aerobic exercise we already discussed: 150 minutes a week, 30 minutes for 5 days, moderate intensity, or you can do 60 minutes per week of vigorous exercise, right? So these are the examples. If you can, this is ideal. Of course, this is in patients who want to do more vigorous exercise. They can do a 60-minute per week of vigorous exercise. Okay. One very important thing you need to do, you need to judge. How does the patient judge the intensity of exercise? Now, of course, we talk about MET and all that, but at a patient level, again, a very useful hack for the patient, for doctors to really talk. How do you judge the intensity of exercise? So you need to give a scale between 0 to 10. 0 is when the patient says that there is amount of effort used while sitting, right? So how much of an effort does the patient have to put while exercising? That is what we need to really or how much is the vigorousness of the exercise which he or she is doing. So if it is equivalent to sitting, it is 0. If it is 1 to 4, then you have lower effort levels below moderate intensity. When it's 5 to 6, it's defined as moderate intensity exercise, which produces a noticeable increase in breathing and heart rate. So if your exercise produces a little bit of increase of breathing and heart rate, that score is 5 to 6. So that is what you need to ask. This is the level of, this is moderate intensity exercise. And then when you have levels of 7 and 8, that is vigorous exercise, that increases more amount of breathing and heart rate. Of course, these are rough definitions. These are rough guideline. And 9 to 10 is very severe exercise where there is a great amount of effort which is involved, right? So we should be targeting somewhere here, right? 5 to 6 or 7 to 8. Generally 5 to 6 is the a sweet spot in terms of exercise on a rigorous scale, right? Now, this is a very useful rule of thumb that you need to understand, right? Now, what you need to understand is that what is a very vigorous exercise? If the individual should be able to carry out a conversation during the activity, right? During the exercise, the patient is able to carry out a conversation, that is considered to be a reasonable amount of effort, and that is not considered to be too high, right? So that's the broad rule of thumb that you need to understand. Now, then you have muscle strengthening exercises. These are anaerobic exercises. So we already discussed that adults with elderly, especially with type 2 diabetes, you need to do both aerobic exercise as well as muscle strengthening exercise. So what are muscle strengthening exercises? This could include weight